Kílala Lelum was built as a cooperative in response to the toxic drug crisis here in the downtown east side. And essentially, it was a group of physicians alongside elders and the local host nations who got together and essentially decided that more services were needed specifically for Indigenous peoples.
We're now 7 years in. We're looking after about 2,000 people living in this neighborhood. We look after children, adults, elders, men, women, all genders. And there's just a lot of heart and a lot of dedication to try and help people to move forward and live their best lives.
A few years ago, a group of us had a vision to develop a space that was demedicalized, that had really under services and supports under one roof.
The goal of the hub is to bring services in a really low barrier way to members. People will have access to social nav services, food security, cultural wellness, connection to elders, knowledge holders, different kinds of workshops and programming. We're going to have a supportive employment program.
The gap that so many people are missing, or the first thing that they need, is to feel good about themselves. And some of it is being able to access things like prescription injectable opiates, just to break the cycle and be able to take a breath and reassess and take a plan in a place that is filled with opportunity.
The service delivery is often very fragmented, and so people have to go to different places to access really the different supports. And so people experience cultural unsafety, right, and racism in a lot of the other settings that they're going to access care within, right? And so what we're doing is we're providing culturally safe, humble care. It's trauma-informed and meets people where they're at, without judgment and with love.
We are wanting to see the whole person in this space and address their needs in a holistic way, and not just be about healthcare specifically, but what does wellness mean in a community context. I think the role of elders in these settings is crucial because it's a point of connection.
If you can have a space where they can come in, right, and to see and know and understand that they're not alone. What I do is just to try and make them see their life in a different way, right? That's all that matters, right? If they can see and know and understand that, they can have that pride for who they are, it can make a big difference in who they are.
The most meaningful part of the space to me is the clinic room. Having our elders in that room and people with, living experience to think through even how the counters or the tables or the bed is set up, right? All of that has been meaningful because we're thinking about how will they feel most comfortable and safe.
The physician in me sees an opportunity to provide medical services here that can't provide anywhere else. To be able to have that all in a place where you feel welcome and at home is going to be pretty special, pretty unique.
This is a space that we are building for community. Our expertise and wisdom is just as valid as theirs in sort of developing what this space will be. And so seeing it as a collaborative effort and really a partnership between members and us as an organization and our other sort of community partners is part of what I think will make this space and program a success.
What we're able to provide here is that there is as close to that full spectrum when you come in. I think there's still room to grow, and I hope that this place is going to be able to try and fill some of those gaps for people who really want to make a change, to be able to take a break from a lot of the chaos. And that's what this place, I think, will do for people.
People are really excited about this. So when people around here are excited about it, that's what excites me.